There we go. All right, guys, this is NCLEX Jeopardy. Welcome, welcome. Awesome. So, hello, I am Nurse Sam. I am the originator and creator of NCLEX Jeopardy. We've been doing this for about 3 years. We started, well, actually, about 4, honestly. The Nurse Sam was started in 2019 to help you guys, all nursing students, RN and LPN, get into nursing school, through nursing school, graduate, and take the NCLEX so they can go ahead and pass and become amazing nurses, real nurses. Gonna always say that joke, so sorry. Let me see what you're saying. All right, perfect. All right, so if you know anyone that is either preparing for their nursing school midterms, finals, whatever, an exam, go ahead and tag them so they can go ahead and join this free and fun review. NCLEX Jeopardy, we are going through just NCLEX review questions in a really fun format. It's a little different. It makes it less overwhelming, and it actually makes studying and learning fun. All right. Practice problems are a great way, and honestly the best way to really understand a concept and prepare for the NCLEX or your nursing school exams. It's just the best way for you to see what the style of the question is, what they're looking for, the wording. So you can really just go ahead and practice pulling out that content from your brain and recalling it. All right. So we have 5 questions. We have 5 categories here. All right. This week's categories, we have pharmacology, fundamentals, mental health, maternity, and pediatrics. Okay. These last 3 categories were actually categories and topics for the last week of camp nursing school for spring semester. So week 3 was actually maternity, mental health, and peds. So this is a great way to kind of close out camp nursing school, which is now over, and prepare for the week 3 recap workbook. All right. So if you guys are ready to play, give me a thumbs up. While I'm getting thumbs up, I'm going to give you a quick rundown of the rules. Okay. Now, we are playing for points. All right. I really love to make it fun. So we are playing for the highest score. Whoever has the highest score at the end of this game, it's going to be about an hour, it's going to win a free Ultimate Nursing School bundle. Okay, a free digital Ultimate Nursing School bundle. That's our bestseller, 400-page, all-encompassing, just really fun study guide. All right, so how you get points? We have 5 questions per category, each accounting for either 100 through 500 points. I'm going to click a question. It's going to be worth that many points. You're going to see the question and the answer choices on the screen, blue background, just like Jeopardy. All right, now you have to answer it Jeopardy style. Okay, that's just to make it fun, make it incentivized. So if you think that the answer is a B or, 2, if it's, numerical, you're going to say, what is? All right, you have to answer it Jeopardy style. So you have to answer it as a question. You have to say, what is 2? What is B? Whatever. This is for both LPN and RN. All right, LPN and RN, although the scope of practice is different, the education is the same. Okay, so all right, I'm getting all thumbs up, so let's go ahead and start. Let's do farm. Want to do farm? All right. Cool, let's do farm, y'all. Which one do I want to do for farm? Let's do farm for 100. Let's start off slow. All right, you do not have to wait for me to read the question in order for you to answer. This is a game of speed because we're playing for points. But do remember that on the NCLEX, it's not a game of speed. Just make sure you are properly timing and pacing yourself. Okay, so don't spend more than like a minute per question. All right, so remember what is, and then the answer if you want the points. If you do not want the points, you don't have to worry about saying what is. But the first person on my screen that answers correctly is going to be the winner of those points for me. All right. But like I said, as long as you get the correct answer, you're good. So let's go ahead and get into pharmacology for 100 points. It says the camp nurse asks the children preparing to swim in the lake if they have applied sunscreen. The nurse reminds the children that chemical sunscreens are most effective when applied at which times? 1, immediately before swimming. 2, 5 minutes before exposure to the sun. 3, immediately before exposure to the sun, or 4, at least 30 minutes before exposure to the sun. What's our answer? I'm getting lots of what it's fors, okay? Remember, whether it's NCLEX Jeopardy or you're doing this on your own by yourself, doing your own review, always ask yourself what the rationale is, okay? So let's see what this answer is and who got the answer, well, the points for this question. The answer is what is for. Ooh, look at y'all. I think like literally everybody got what is for. So great job. All right. The answer is what it's for, which is at least 30 minutes before exposure to the sun. All right. Let's read the rationale. Even though you got this correct, a lot of you guys got this, if not everybody got this correct, make sure you are noting the rationale. All right. A lot of the answers to a bunch of future problems will lie in the rationale of the NCLEX practice problem that you're using, okay? I promise you. You've taken enough of these, they start to repeat. All right, so it says sunscreens are most effective when applied at least 30 minutes before exposure to the sun so that they can penetrate the skin. All sunscreens should be reapplied after swimming or sweating. All right, first person on my screen, okay, to get this correct and say what it's for is Bianca Rella. Congratulations, Bianca. You are now on the scoreboard with 100 points. Great job to everyone that got what it's for. Even though you weren't first, you at least got it correct. So if this was the NCLEX, you would have gotten those points. All right, so let's go ahead and get to the next question. All right. We did farm. Let's do maternity next. I just posted something about Nigel's rule. And let's go ahead and just tap into maternity. Let's do maternity for 300. All right. No, it's not because you didn't put a question mark. It's just literally because she was first. As long as you say what is and then the answer, I don't care what other characters you put in there. All right. So once again, for anyone that's new, this is NCLEX Jeopardy. Hello, welcome. I am Nurse Sam, the host of NCLEX Jeopardy every Thursday at 7 p.m. right here on TikTok Live. All right. Right now, we just started our maternity category. This question's for 300 points. So first person to answer and say what is, and the correct answer is going to be the winner of those points. It says the nurse in a healthcare clinic is instructing a pregnant client how to perform kick counts. Which statement by the client indicates a need for further instruction? Okay. 1, I will record the number of movements or kicks. 2, I need to lie flat on my back to perform the procedure. 3, if I count fewer than 10 kicks in a 2-hour period, I should count the kicks again over the next 2 hours. Or 4, I should place my hands on the largest part of my abdomen and concentrate on the fetal movements to count the kicks. What is our answer? All right. Test taking tip that I always repeat every week. Once you read through the question and the answer choices, go back and at least read that last line. Reread that last line to remind yourself of what the question is actually asking. All right. Which statement by the client indicates a need for further instruction. Okay. Whenever you see this, a need for further instruction, and you're looking for a statement that indicates a need for further instruction, you're looking for an incorrect statement. Okay, best way to answer that and go through it is to true or false each answer choice. Go through it one by one. All right, the one that is false is going to be the correct answer. All right, so let's look and see what that answer is. And the answer is what is 2? All right, 2 says I need to lie flat on my back to perform the procedure. The answer is what is 2. First person to get what is 2 is Sage X3. Great job. A lot of people said 3, but we're going to go through it. Sage X or Sage, I'm not sure. SADGE. There you go. Great job. Congratulations. You are now on the scoreboard with 300 points. All right. So let's get into the rationale. Remember, note this if you got it wrong, especially if you got it wrong. No shame, but we don't want to get got again, right? says the client should sit or lie quietly on her side to perform kick counts. Lying flat on the back is not necessary to perform this procedure. It can cause discomfort and presents a risk of vena cava. Vena cava syndrome, aka supine hypertensive syndrome. All right, that is very important. The client is instructed to place her hands on the largest part of the abdomen and concentrate on the fetal movements. That is true. The client records the number of movements felt during a specified time period. And the client needs to notify the primary healthcare provider, or PHCP, if she feels fewer than 10 kicks over 2 consecutive 2-hour intervals, or as instructed by the PHCP. Make sense? Thumbs up if that makes sense, if you are ready to get on to the next one. All right. But great job, guys. But yes, the answer is definitely what is 2. When it comes to maternity, whenever you see some type of positioning and the statement or maybe the question is indicating that the pregnant mom or the expectant mother is lying flat on the back, that needs to raise concern, okay? You do not want to be flat on the back, flat on the back, or lie flat on the back, especially when you're pregnant, because of the risk, once again, of that vena cava syndrome. All right, BP is going to go way down. BP is down, blood and oxygen isn't flowing to mom, and if mom isn't getting blood and oxygen, guess who else isn't getting blood and oxygen? Right? Little peanut. Okay, so yes, vena cava syndrome is bad. So if you see somebody say, I'm gonna lay flat on my back to do anything, she could be laying flat on her back to get I almost said something wrong. But yeah, it needs to be lied. As far as positioning, actually, second part to this, we already know that they can't lie flat on the back, all right, to perform any procedure. But lying flat on the back is bad. What is the preferred positioning? What is the preferred positioning for pregnant, expecting mothers? You heard that? Left side, side lying. Correct. That's why they always got them pillows. Left side lying. So side lying, yes, but you need to specify that it is the left side. So great job, guys. Let's do fundies, and let's do it for let me see. Hold on. Let's do it for 100, mostly because I want y'all to see this question. Ready? Lego. This is fundies for 100 points. Which client is at risk for the development of a potassium level of 5.5? I love this question because it's giving me critical thinking, and I love it. All right, this is a great way, honestly, to exercise it. But yes, who's at risk for the development of a potassium level of 5.5 milliequivalents per liter? 1, the client with colitis. 2, the client with Cushing's syndrome. 3, the client who has been overusing laxatives. Or 4, the client who has sustained a traumatic burn. You need to tell me what the answer is. So what is, and then whatever number. And then you need to tell me why. All right. So say what is and then whatever, and then press enter so you can get your timestamp. And then you need to send another message and tell me why. Not necessarily tell me why, but you need to tell yourself why. Okay. It's very important, especially if you're going to be taking the next generation NCLEX. Knowing the rationale and knowing why you have a certain answer is going to play even more of a bigger role than ever, because that's literally a question type. Okay. It will literally ask you, like, this will be the first part of the question. And then part 2 of the question will be, okay, then tell me why. And if you get that wrong, all that's wrong. All right. It's called a rationale type question. Those are not partial credit. If you get one wrong, it's 2 parts. It's the answer and then why. If you get one wrong, they're both wrong. Okay. So let's see what you guys are saying. All right. A lot of people are saying either 4 or 3. So people saying either 3 for overusing laxatives, 4 sustained a traumatic burn. All right, let's go ahead and walk through this. All right, let's start. Remember I said read it all the way through and then go back and break it down. All right, we have a client at risk for the development of a potassium level of 5.5. All right, 5.5, what is the interpretation of this potassium number? Is that high, low, or normal? Okay. Then next step, you got to figure out what could possibly cause that either imbalance or whatever, that high, low, normal balance. All right. So this is high potassium. All right. We know this is high potassium. If you're taking the, really quick, who's taking the current NCLEX and who's taking the next gen NCLEX? Okay. If you're taking the current NCLEX, you will not receive lab values. If you're taking the next generation NCLEX, you will receive the normal lab values. All right, so you'll receive a little chart that will say potassium normal reference range, which is what? Tell me what it is. What's normal reference range? A lot of people are taking next gen, so you really don't need to know this, but at the same time, you need to know this. Okay, you need to know what happens if it's too high, how it affects the body. Okay, or if it's too low, how it affects the body. All right. So yes, normal is 3.5 to 5. So this 5.5 means we have hyperkalemia. All right. Too much potassium in the body. How? If we have hyperkalemia, what are we at risk for? Okay. And the answer is what is 4. All right. The client who has sustained a traumatic burn. I said it backwards. I'm sorry. We're at risk if we have what? We're at risk for having a high potassium level. And the answer is traumatic burn. All right. Clients who experience cellular shifting of potassium in the early stages of massive cell destructions, such as trauma, burns, sepsis, or metabolic or respiratory acidosis, are at risk for hyperkalemia. Okay, the client with Cushing syndrome or colitis and the client who has been overusing laxatives are at risk for hypokalemia, aka low potassium. All right, that makes sense? Thumbs up if that makes sense. Let me see who got the answer first. All right, let me see. First person to answer this correctly and say what is 4 is Shay 28. Hey she _ is it Shay? Yes. 28? Yes. Awesome job. You are on the scoreboard with 100 points. Great job. All right, so everyone that said what is 4 and give me your reasoning, I'm just going through and seeing what you guys are saying. Fluid loss is a major concern with burn patients. She said number 1. Ooh, great job. All right. Taylor Lee, great job, guys. All right, let's go ahead and get to our next question. Okay. Now let's do... Want to do that one? Wait, I heard y'all said farm. Y'all are like, I want to do farm. Okay, let's do farm. Let's do farm, guys. All right, let's do for the farm. It's farm for 300. The nurse is providing instructions to the client newly diagnosed with diabetes mellitus who has been prescribed pramlintide. Which instruction should the nurse include in the discharge teaching? 1, inject the pramlintide at the same time you take your other medications. 2, take your prescribed pills 1 hour before or 2 hours after the injection. 3, be sure to take the pramlintide with food so you don't upset your stomach. And then 4, make sure you take your pramlintide immediately after you eat so you don't experience a low blood sugar. All right, which instructions should the nurse include in the discharge teaching? All right, what is our answer? Don't forget to say what is, because this is NCLEX Jeopardy and we answer our questions Jeopardy style. Okay. All right, this is a farm question. So you need to pay attention and know, obviously, the medication, the drug in this question. Pramlintide. Please remember that for pharmacology, you will not, on the NCLEX, you will not see brand names. You will only see generic names. Okay? Remember to tell me why you got your answer. All right, what kind of medication is pramlintide? We have a client newly diagnosed with diabetes mellitus, and they were prescribed pramlintide. All right. What do we know about it? Let's see what that answer is. Answer is what is 2. What is 2? Take your prescribed pills 1 hour before or 2 hours after the injection. All right, what is 2? First person to get that is She Say Again. Shay. Girl, you know that's a tongue twister. Why you did that to us? All right, great job. Shay, you had 100 points. You just got another 300. So now you have 400 points. All right, putting you in first place. Then we have Sag with 300 and then Bianca with 100. Remember, the person with the highest amount of points at the end of this game, which is going to be about 8 p.m., will be the winner of 1 free digital Ultimate Nursing School bundle. All right. So let's go through our rationale. It says pramlintide is used for clients with type 1 and type 2 diabetes mellitus who use insulin. It is administered subcutaneously before meals to lower blood sugar levels after meals, leading to less fluctuation during the day and better long-term glucose control. Now, because pramlintide delays gastric emptying, any prescribed oral medication should be taken 1 hour before or 2 hours after an injection of pramlintide. Okay? That's very important. All right? So because it delays gastric emptying, this is the important part right here. Because it delays gastric emptying, this is why we're taking the this medication 1 hour before or 2 hours after. Okay? That is your right. That is your why. That is your rationale. Please put a star next to it. Note it. Screenshot it. Whatever. Okay? It says pramlintide should not be taken at the same time as other medications. It's given immediately before the meal in order to control that postprandial rise in glucose. Postprandial, that's a very important word. Y'all know that word, right? Y'all know what that means? What does postprandial mean? Really quick, what does postprandial mean? All right, but we know that the pramlintide is given immediately before eating the meal in order to control that postprandial, which post-meal after eating, great job guys, rise in blood glucose, not necessarily to prevent stomach upset. Somebody said what anti-diabetic medication usually causes stomach upset. Which one is most known? It's an anti-diabetic agent that usually causes stomach upset. That is a very common complaint. What is it? What is that medication called? You better get it, Lord 917. Metformin. Absolutely. Okay. So if you see a metformin question and it has anything to do with patient teaching or, side effects, something that you need to tell the patient, expect some stomach upset. Here's what you can do to minimize it. All right. So just want to let you know that. Okay. Then it says it is incorrect to instruct the client to take the medication after eating as it will not achieve its full therapeutic effect. That's very important. This is a very NCLEX style question because they love diabetes questions. They love diabetes questions. All right. And that's because it's common. It's a common disease/disorder. So they're going to make sure that you understand the common complexities of the disorder and what you can do, because you'll most likely come in contact with a patient that has it as a nurse. All right, let's do mental health, because we haven't done a mental health question. All right, let's do mental health for 400. The nurse is creating a plan of care for a client with autistic disorder. A behavioral modification approach, aka operant conditioning, is being used to improve communication, which should the nurse include in the plan of care. 1, promote complete independence in the client. 2, strengthen the client's ability to manage stress. 3, reward the client when a desired behavior is performed. And then 4, provide consistent negative reinforcement to promote appropriate behaviors. What is our answer? This is mental health for 400 points. This is NCLEX Jeopardy for anyone that is new, just got in the room. All right. We're answering NCLEX style questions. This is for both RN and LPN. Because why? Scope of practice may differ, state to state. But scope of practice may differ. However, the education is the same. All right. What is the answer to this question? First person to answer correctly using the what is format is going to be the winner of these points. What are y'all saying? Y'all are saying, I'm seeing lots of 3s, which is reward the client when a desired behavior is performed. All right. What is our why? I'm seeing some 1s. I'm seeing some 1s and 2s. All right. Somebody's side of Pablo said operant rewards / punishes mod behavior. Let's see what the answer is. Y'all ready? And drum roll, please. What is 3? Operant conditioning entails rewarding a client for desired behaviors and is the basis for behavioral modification. It uses a positive reinforcement approach. None of the remaining options are characteristics or appropriate components of the plan of care for this form of therapy. Great job. Who was that got it? I'm not sure if you were first in answering this, but you gave me a good rationale. Thank you for that. All right, so first person to answer this was, and say what is 3 is Jazz LaShawn. Hey, Jazz. What's up, boo? Great job. All right, Jazz, you are on the scoreboard now with 400 points. And you are tied with Shay. Dang it, Shay, what I said about this? We're just going to call you Shay, okay? You're tied with Shay with 400 points, but we still have some time to break this tiebreaker. Of course, we have more questions to go through. All right, give me a thumbs up if you guys are A, enjoying this, and B, learning a lot. Learning something. All right, let me know when you're ready to go to the next question after I see those thumbs up. Great job to everyone that was giving me rationale. All right, getting some thumbs up. It looks like y'all are ready to go. That was you, Sada Pablo. Great job. All right, here we go. That was mental health. Let's do peds now. Yeah. Let's do this one. This is 500 points, guys. A 500 pointer. All right. The nurse is caring for a client. Wait, hold on. All right, sorry. The nurse is caring for a client with a diagnosis of bladder exstrophy. To protect the exposed bladder tissue, the nurse should plan which intervention. 1, cover the bladder with petroleum jelly gauze. 2, cover the bladder with a non-adhering plastic wrap. 3, apply sterile distilled water dressings over the bladder mucosa. Or 4, keep the bladder tissue dry by covering it with dry sterile gauze. What is our answer? All right, we're caring for an infant with bladder exstrophy. We're trying to protect that exposed bladder tissue. So what should our intervention be? Don't forget to give me my why. A lot of people are saying 3, which is apply the sterile dressing. I'm sorry, what? Apply sterile distilled water dressings over the bladder mucosa. Okay, let me see what y'all are saying. Like, literally a lot of people are saying 3. Some people are saying 2. All right. Let's see what that answer is. What is 2? Cover the bladder with non-adhering plastic wrap. Ooh. What is 2? Did anybody get what is 2? I am not saying your name out loud. You trying to get me banned? P hat. Yeah, P hat. I don't know if you're trolling us or if you're real. I have no idea. But you were the first person to say what is 2. I'm gonna call you fat. All right, fat. Nah, I can't even do that. It's weird. It's weird. Because I know what the rest of your name says, so I can't even do it. All right, you're in the score of 500 points, but just in case you're fake, Mo Kim's the next person to get it. But great job, everyone that said what is 2. All right, so, I'm real. I gotcha, perfect. All right, it says, in bladder exstrophy, the bladder is exposed and external to the body. In this disorder, one must take care to protect the exposed bladder tissue from drying out, all right, while allowing the drainage of urine. This is accomplished best by covering the bladder with a non-adhering plastic wrap. The use of petroleum jelly gauze should be avoided because this type of dressing can dry out, all right? Can dry out, adhere to the mucosa, and damage the delicate tissue when removed, okay? Dry sterile dressings and dressings soaked in solutions that can dry out also damage the mucosa when removed, okay? So that's why all 1, 3, and 4 were not the correct answers, all right? You want to keep it from drying out while still allowing that drainage of urine. All right, that's your priority. Come on. Great job, guys. So I know I need to study. It's okay. That's why we do this. Okay, this is great practice. All right. Did I say who got that? Yep, I did. Great job, guys. Let's go into. Let's do fundamentals again. Someone said, why not 3? It wasn't 3 because it said that even dressings soaked in solutions that can dry out, they also damage the mucosa. This one was apply a sterile distilled water dressing. This can dry it out. All right. All right, so let's do what, fundamentals? Yeah, let's do fundies. Let's do fundies. Let's do fundamentals for 300. You're welcome. All right. It says a gastrectomy is performed on a client with gastric cancer. In the immediate post-operative period, the nurse notes bloody drainage from the nasogastric tube. The nurse should take which most appropriate action? 1, notify the surgeon. 2, measure abdominal girth. 3, irrigate the nasogastric tube. Or 4, continue to monitor the drainage. All right, the nurse should take which most appropriate action? All right, read back through the whole thing if you have to. Give me the answer, and then give me why the answer is the answer. All right. Remember to look at the situation. then look at the problem, and then what the question's actually asking you. All right. I'm getting kind of like a little bit of everything. I'm going to say 4. It's normal. No. All right, let's see. Ready? You go, Sarah Lee. Immediate post-op is expected. Great job. I just saw that when it just popped up. But yes, it is 4. Continue to monitor the drainage. All right. It says following gastrectomy, drainage from the nasal gastric tube is normally bloody for 24 hours post-operatively. Changes to brown tinged and is then yellow or clear. Okay. Remember, it said that we are in the immediate post-operative period. I don't even know if they're woken up from anesthesia yet. It's immediate, you know? So yes, you can still definitely expect some blood to be draining from that nasal gastric tube. It was placed there literally 30 seconds ago. Okay? But yeah, that's just, if you read too fast, you'll go over it. But that's why paying attention to wordplay is very important on the NCLEX. Okay? Who's the first person to say what it's for? Hold on. First person to say what it's for is Bianca. Great job, Bianca. All right, Bianca, you're already on the scoreboard with 100 points. You just got 300, so now you have 400 points. Awesome job. Great job, guys. All right, we're all good. We're all good to know. Good to go on to the next one. Thumbs up if you're ready to go on to the next one and you grasp this one. Give me a thumbs up. Perfect. Let's go. All right. Please remember to tag any of your classmates, any other nursing students that may want this free and fun review. All right, let's do maternity for 200. All right. Which statement reflects a new mother's understanding of the teaching about the prevention of newborn abduction? 1, I will place my baby's crib close to the door. 2, some healthcare personnel won't have name badges. 3, I will ask the nurse to attend to my infant if I am napping and my husband is not here. 4, it is okay to allow the nurse assistant to carry my newborn to the nursery. Which statement reflects a new mother's understanding of the teaching about the prevention of newborn abduction? All right. So this is the opposite of which statement indicates the need for further teaching. All right. Further teaching lets us know you don't quite get it, boo. Let me run it back. Let me say it again in a different way. This one, they understand the question. So you're looking for the true answer. You're looking for the correct answer. So even if you go through and true, false, like you would do with the other type of question, you can do it with this one as well. Or you can just go through and look and see which one's true. All right, so let's go and see what our answer is. The answer is what is 3. The answer is what is 3. I will ask the nurse to attend to my infant if I am napping and my husband is not here. That is letting us know that they have a good understanding of how to prevent newborn abduction. Okay. It says precautions to prevent. Well, first, actually, let me scroll up and see who got this first. First person to say what is 3 is Daya Mackay 2. Daya, great job. Okay, Daya, you on the scoreboard with 200 points. Let's get into that rationale. All right, it says precautions to prevent infant abduction include placing a newborn's crib away from the door, transporting a newborn only in the crib and never carrying the newborn, expecting healthcare personnel to wear identification that is easily visible at all times, and asking the nurse to attend to the newborn if the mother is napping and no family member is available to watch the newborn, aka the newborn is never left unattended. Okay. If the mother states that she will ask the nurse to watch newborn while she is asleep, she has understood the teaching. All right. Options 1, 2, and 4 are incorrect and therefore indicate that the mother needs further teaching. All right. Make sense? All right. Make sense? Everybody good? I think everybody pretty much told Scott what is 3. I'm glad everybody knows how not to, put your baby in the line of fire. Great job. I'm so glad everybody got that right. All right. Next question. That was maternity. We did funnies. We did farm. Let's do. Let's do farm for 500, actually. And what time is it? Let's do farm for 500, guys. This is a good one because this is a common one. All right. All right. The nurse is taking care of a client receiving oxybutynin. Which findings should the nurse expect to note if the client develops side or adverse effects of this medication? Tell me why. 1, itching. 2, diarrhea. 3, swelling. 4, dry mouth. Tell me why. Tell me what kind of medication. Your why should be you telling me what kind, like what classification of medication oxybutynin is. And then tell me what side effects. Well, I guess you said that. All right, y'all good? Tell me the classification, not necessarily what it's for. All right, let's go. What is for? All right. Oxybutynin is an anticholinergic. If you don't know nothing, please take this away from pharma, especially if you struggle with pharmacology. Please take away this tip that I'm about to tell you, okay? When it comes to anticholinergics, oxybutynin is a very, very, very common example that the NCLEX nursing school just loves to test you on, all right? You need to know oxybutynin. When you see that, oxybutynin is an anticholinergic, okay? That's one of the most common ones. Now, for anticholinergics, like I always say, well, before we get there, like I always say, whenever you're studying pharmacology, especially side effects, adverse effects, nursing considerations, those things like that, whenever you're studying your medications or your different drugs, make sure you're doing it and grouping it by the classification. Okay. Why? Because the side/adverse effects will most likely be the same. All right. So the side effects for the group of anticholinergics are going to be the same for oxybutynin and for another one. Somebody tell me another anticholinergic. All right. Now, in the meantime, let's go ahead and focus on anticholinergic side effects. You need to know this. All right. And I'll help you come up. Well, not help you, but I'll tell you a great way to remember these anticholinergic side effects because it's very important. All right. Now, the side effects include dry mouth, which is why number 4 was correct. Great job. Atropine is another. Great job, guys. Constipation, tachycardia, urinary hesitancy, urinary retention, mydriasis, blurred vision, and dry eyes. There's a lot of words that say dry, right? It's giving dry. It's giving dry out. Okay. All right, you have dry mouth. If you have a dry digestive tract, you're going to have constipation. All right, dry eyes. So just note that. Think about that. All right. Itching, diarrhea, and swelling are not associated with this medication. Okay. So the main things that you want to think about when you're thinking about or when you're asked about anticholinergic side effects, you want to think about these 4 things. Can't see, can't pee, can't shit, can't spit. Got it? Hold on, I'm about to write it. About to write it because we're going to learn this today. Y'all going to thank me later. Y'all gonna thank me later, okay? All right. Can't see, can't spit, can't can't see, can't pee, can't spit, can't shit. That's what it is. Well, that's how I remember it, just because I'm inappropriate. But let's go ahead and get to this one. Here we go. All right. Here we go. All right, so let me actually put it right here. All right. Let's actually just put it right there. Here we go. So, anticholinergics. You need to know this. How you spell it? Cholinergics. Okay? You can't do these 4 things. All right? You can't. All right? Four things are, and they rhyme too. That's what definitely helps you. You can't pee. You can't see. You can't spit. And you can't, you know what that is. Okay? And what does that equate to? You can't pee is going to be your urinary. It's going to bother me. It's going to be your urinary retention. That's really going to bother me, so I'm so sorry. Urinary retention. All right, so urinary retention. All right, and that's one of the side effects. Next one, can't see. That's going to be your blurry vision. All right, blurry vision and dry eyes. Boop, 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 boop. Can't spit. It's going to be your dry mouth. And then can't is going to be constipation. Okay, so whenever you need to remember what those side effects are, those main side effects of anticholinergics, you want to think about your 4 can'ts. Okay. Oop, I almost lost it. Yeah, you want to think about your 4 can'ts. All right. Can't pee, can't see, can't spit, can't shit. Hey, that's how I remember it. Okay. So yes. Cool. We got that. We good to go? We got that? There you go. There you go. There you go. All right. Last question, guys. I gave those. Did I give those points? No, I didn't. Hold on. Let me see who got that first. Next question. Hold on 1 second. First person to get that one was Jazz. Hey, Jazz, you already had 400 points. You just got an extra, Jazz LaShawn, by the way, extra 500. So you now have 900 points. Girl, you just shot to the top. All right, we still have 1 question. We're going to do a 500 pointer right here. I'm just trying to figure out which one I want to do. Hold on. There we go. All right, let's do mental. Somebody said, all right. Ooh, I posted something about this. All right, the nurse is caring for a client diagnosed with Alzheimer's disease who is demonstrating characteristics of agnosia, which client behavior supports the presence of this cognitive deficiency. 1, the client has difficulty with balance when rising from the chair. 2, the client has lost the cognitive ability to fold his own clothes. 3, the client recognizes his children but has difficulty calling them by name. Or 4, when asked to pick up the cup, then the client consistently fails to identify the cup. What is our answer? This is mental health for 500 points and also our last question of the evening. All right, which client behavior supports the presence of the cognitive deficiency agnosia? All right, I'm getting lots of what is threes. Lots of what is threes, which is the recognizing children but can't call them by name. All right, remember to say what is if you want the points. Remember to say what is if you want the points. All right, so answer to this question, drum roll please. Y'all ready? Ooh, what is 4? What is 4? The answer is actually when asked to pick up the cup, the client consistently fails to identify the cup. Okay, the answer is what is 4. All right, first person to answer that correctly was actually, what is 4? Jazz LaShawn. You go, Jazz. Okay, Jazz. Jazz did not come to play with anybody. All right, Jazz, you were at 900 points, and you just got another 500, which means you have broken the 1,000-point club. You are now at 1,400 points. All right, and officially our winner, but we'll talk about that in just a second. But great job. Great job to everyone that got what is 4. The answer is what is 4. Rationale says, when illness, aka Alzheimer's disease, affects the temporal parietal occipital association cortex, the client may experience the inability to identify well-known objects in people. This is called agnosia. Ataxia describes altered motor function. Okay, so number 1 describes ataxia. All right, remember that's like that altered gait. Okay, the client also may experience difficulty finding the right word to use, which is called aphasia. All right, and then an inability, which one's that? That's number 3. And then the inability to perform familiar skilled activities is called apraxia. All right, that one's number 4. Not apraxia, I'm sorry. That one is actually number 2. Sorry, apraxia is number 2. But the answer is number 4. That is agnosia. All right, does that make sense? You remember your 5 A's of Alzheimer's disease? All right, you remember your 5 A's? If you don't have my Ultimate Nursing School bundle or my mental health bundle, you should get it. You should get it. All right, it's definitely in there. If you go within the mental health section, if you have it, if you go to your Ultimate bundle or your 3rd semester bundle, go to mental health and then go to where we are talking about our, I almost said mental disorders. Del girl, that's the whole thing. Go to, where is it? Neurocognitive disorders. Right here. All right. Boop, boop, boop. If you don't have this is what you should have. Okay. Right here. Neurocognitive disorders. All right. This is going to give you your 5 A's of Alzheimer's disease. All right. There we go. Okay. So yes, let's look at that. We're looking for the agnosia. This is the agnosia. This is a great way for you to remember it. Okay. Anomia. All right. You can think about the word name. All right. Nomia is kind of similar to name, gnome, name, whatever. That's the inability to remember names of things. All right. So gnome, name. That's how I remember it. 2, apraxia. All right. Remember, apraxia was the inability to perform familiar skilled activities. All right. It's also or you can describe it as the misuse of objects because of failure to identify them. All right. Apraxia, and agnosia. That was what our question was asking. You know, which was a characteristic that was demonstrative of agnosia. And what agnosia is the inability to recognize familiar objects, taste, smells, etc. All right. Recognize, have that G and that N. All right. Oops. Yeah, that G and that N right next to it, like agnosia. All right. So recognize And agnosia, that's how I remember it. All right. Even says it right here for your study tip. Recognize the GN in agnosia. All right. Next thing, amnesia. It's memory loss. I don't know if y'all remember that song Amnesia by Cherish. Like, do y'all remember that song? Yes or no? Really quick, just put in the comments if we're like a part of the same tribe and you remember or had amnesia playing on your MySpace back in the day in middle school. But yeah, that's what I think about. It's literally a song by Cherish called Amnesia. It's about forgetting something. Like it's memory loss. So that's always something that I just remember and associate when saying that word. And then aphasia. It's the inability to express oneself through speech. All right. How I remember it, here's our study tip. Going through a phase of no speech. All right. A phase of no speech. And plus the S in phase, I think about the S in speech. That's how I remember it. All right. So yes, this is the 5 A's of Alzheimer's disease. Make sure you grab that. That is once again within the Ultimate Nursing School bundle, specifically within the mental health nursing schools study kit. All right. All right, guys. So once again, that concludes our game of, put this back. That concludes our game of NCLEX Jeopardy. If you guys would like to play again, make sure you come back. We do this every Thursday at 7 p.m. Eastern Standard Time right here on live. Once again, for RNs, LPN students, or anyone that just wants a refresher, okay? Our winner from tonight's game with 1,400 points, as I said before, was Jazz LaShawn. Congratulations. Great job, great job. Great job to all of you, honestly. Thank you so much for spending an hour with me as we go and we review some NCLEX study tips. Jazz, you have won a free Ultimate Nursing School bundle, so you actually win the very document that I was in earlier as I was showing you guys those tips. That Ultimate Nursing School bundle is our 400-page digital study guide. Okay, right here. Boop, boop. It's going to have everything you need, especially of all these topics right there. All right, so Jazz, DM me either here or on Instagram if it's easier for you. DM me your first name and last name, your full name, and also an email address so we can go ahead and send you your digital bundle, send you your prize. Great job, everybody. Thank you so much. Congratulations again, Jazz, and congrats to everyone that got on the scoreboard, or even if you didn't get on the scoreboard, if you answered those questions correctly, it means that you're retaining the content. You're answering it correctly. On the actual NCLEX, it's not Jeopardy style. That was just us having fun. But in the actual NCLEX, you're answering the answers correctly. So you should pat yourself on the back. Just because you didn't get the most amount of points, you still did your thing. Okay, so great job, everybody. If you want to watch some replays, make sure you check out our YouTube. Also, make sure you check out our 40% off discount and sale that we have going on all digital products. So if you want this Ultimate Nursing School bundle, use code LOVE40 either in my app or on the website, thenursam.com, for 40% off. All right, it'll be right under $59 versus $97 if you get it with the LOVE40 discount code. All right, that does end on the 19th, which is Sunday night, so make sure you don't miss out. All right, now, I know y'all see that we have more questions to play. If you want to play the full 25 questions, make sure you download the NurseSam app, okay? Go to the link in my bio or my website, and you'll see where it says download the app. It is free. It's also available in your app stores for iOS and Google Android Play. I don't know what it's called, but it's also in those app stores. You can search the NurseSam, or like I said, just go to the direct link in my bio so you can download that free app, enabling you to play the app exclusive NCLEX Jeopardy. We also have the Tease version as well within the Tease prep. All right. So once again, free to download, free to play. If you want to play the 25 free NCLEX questions, NCLEX practice questions weekly, make sure you download the free NurseSam app. All right. It's a great way to practice and a great way to prepare for the NCLEX and your exams. Okay. The gummies are not in stock yet. We will let you know as soon as they are. Make sure you have the app downloaded and you're a part of our email list, so you'll be one of the first to know. All right, guys, thank you so much. I will see you next week, same time, same place, right here on TikTok Live at 7 p.m. Eastern Standard Time. All right, any questions? Mm-mm-mm. Mm-mm-mm. Okay. All right, there we go. All right, thanks, guys. Bye.